Hello, and welcome to this edition of Doc Talks. I'm Dr. Don Selvey, a naturopathic physician practicing in Chandler, Arizona. In this version of Doc Talks, we're going to focus on vitamin B12. A medical disclaimer that's necessary. We are only going to provide information for educational purposes here. Nothing should be construed or intended for medical advice, diagnosis, or treatment. Do not use this in place of advice of your own physician. If you'd like to make an appointment, we'll give you that information at the end of this presentation. Vitamin B12 is used in many important body functions, including formation of red blood cells, synthesis of DNA, proper nerve and neurologic function, and body metabolism. B12 is one of the B complex vitamins. All of the B complex vitamins and C vitamins are water soluble. That means they are not stored in the body, but pass out through the urine. By contrast, vitamins A, D, E, and K are fat-soluble vitamins, and therefore they're going to be stored in body fat until they are needed. Because B12 is not stored, you must have enough in your system to ensure a continuous supply. B12, necessary for red cell formation. Our blood is comprised of red cells, white cells, and platelets in a liquid matrix that we usually call plasma. When we draw blood from someone and put it in a test tube and then spin it down, we're actually separating the red cells, the white cells, and the proteins out and producing a layer of serum on top of that. The red cells, also known as RBCs or erythrocytes, carry oxygen and carbon dioxide. I know a lot of people have very strong reactions to the sight or even the thought about blood. So I tell my anatomy physiology students to think of red cells like a cargo truck with only two kinds of packages, oxygen and carbon dioxide. Red cells have a life expectancy of 120 days under the best of circumstances. If you care, one of the functions of the spleen is to evaluate and destroy aged red cells. So why do we care so much about oxygen being carried by red cells? And here's more information than you probably want to know, but oxygen is what's known as an electron receptor in the inner membrane of the mitochondria. This is where energy is made, and the energy that we're talking about is adenosine triphosphate, or ATP. Every reaction in our body requires ATP. Without ATP, everything in our body stops. In fact, you may have heard of rigor mortis, the rigidity of death, and that is caused by a lack of ATP in the body after a person dies. If we have a deficiency of vitamin B12, we will necessarily also have a deficiency in red blood cells. And since the red cells carry the oxygen and carbon dioxide to and from tissues, a deficiency in RBCs, a deficiency in B12, very quickly leads to fatigue. A deficit of red blood cells in the body is what we call anemia. And while there are several subtypes of anemia, it's important to note that all red blood cells must have hemoglobin, and vitamin B12 is necessary to make hemoglobin. Pernicious anemia is a specific type of anemia in which the body cannot absorb vitamin B12. Vitamin B12 is also needed for DNA synthesis. As you probably remember from middle school or high school science class, DNA is our cellular blueprint. It directs our cells to make whatever it is the cell needs to make, usually a protein. In fact, one of the reasons that some viral diseases are so devastating for us, even fatal for us, is that the virus gets into our DNA and disrupts it. Vitamin B12 is what is necessary for DNA synthesis. Vitamin B12 is also necessary for proper nerve and neurologic function. Personally, I think nerve function is so complex and fascinating. I love talking about it. One of my graduate degrees was actually in neurophysiology. I want you to imagine a wave going around a stadium with people jumping up, saying woo, and sitting back down in this choreographed sequence all the way around a stadium, maybe a couple of times around. Instead of people, though, going through a stadium, I want you to imagine certain cellular ions, sodium and potassium are two of the most important, moving in and out of a nerve cell in the same highly structured choreographed sequence. At each nerve-to-nerve junction or nerve-to-tissue junction, this electrical signal has to be converted to a chemical signal and then has to be converted back to an electrical signal. It's a fascinating and complex activity. Bottom line for us is that a deficiency of vitamin B12 disrupts that normal nerve function. We use as an example of this peripheral neuropathy, which can be treated effectively with vitamin B12 injections. Peripheral neuropathy is caused by several different conditions, most prevalently diabetes. It is a severe, debilitating, disabling pain, usually of the lower extremities. Patients will describe it as an unquenchable burning pain, and they can be absolutely desperate for an effective treatment. While there are commonly prescribed medications, not all of them are going to be effective in treating peripheral neuropathy. Remember, there are multiple causes of peripheral neuropathy. B12 has been effective in some people and should be considered by anyone with a peripheral neuropathy. B12 is important in a lot of body functions, particularly what is called methylation. Methylation is a biochemical reaction in which a methyl group is added to another molecule. In some ways, this might be like putting gas in your car's gas tank. So for DNA, RNA, many hormones, proteins, lipids, and 100 more substrates, we must methylate those molecules in order for them to do what they're supposed to do. The universal donor for methyl groups in our body is a molecule identified as S-adenosylmethionine, which thankfully we generally abbreviate as SAMe. SAMe is made from a molecule called methionine. Methionine is made from homocysteine. Homocysteine is broken down into methionine and then into SAMe by, you got it, vitamin B12. If there is a deficiency of vitamin B12, there will be an excess of homocysteine, a deficiency of methionine, a deficiency of SAMe, and a lack of methylation. Therefore, your car is going to run out of gas. Vitamin B12 is derived from the mineral cobalt, a transition metal for those of you into the periodic table. There are two forms that our body actually uses, methylcobalamin and 5-deoxyadenosylcobalamin. While there are other forms of cobalamin, such as cyanocobalamin and hydroxycobalamin, only these two are actually used in our bodies. B12 is found naturally in animal products such as fish, meat, poultry, eggs, milk products, but B12 is not generally found in plant food. In food products, B12 is bound to a protein. That is to keep it from being filtered out by the kidney and passed out through urine. In order to be used in our body, B12 must be freed from that transport protein and then combined with another molecule called intrinsic factor that is produced in the stomach. When B12 is bound to intrinsic factor, it can be absorbed in the distal section of the ileum in our small intestine. There are a number of digestive system conditions that interfere with B12 absorption. When there is no absorption of B12, there is going to be a deficiency. Conditions which may cause B12 deficiency include atrophic gastritis. This is a condition that occurs in about 30% of older adults, and it basically is a loss of the production of hydrochloric acid called ahydrochloria. Pernicious anemia, we mentioned before, is prevalent in about 2% of the population, and that again is simply the inability to absorb B12. Crohn's disease and celiac disease are also going to cause an inability to absorb B12 and therefore cause a B12 deficiency. Anyone who has had stomach surgery, such as for weight loss purposes, or they've had surgery on that ileum in the small intestine, they're likely to have problems absorbing B12. And finally, patients with peptic ulcer disease frequently have the inability to absorb vitamin B12. All of this leading to a deficiency and all of the consequences and sequelae thereof. People who are on strict vegetarian or vegan diets are likely to have a deficit of vitamin B12. It's only going to be found in those animal products. What is even more important is that the baby of a mother who is a strict vegetarian or vegan is going to be lacking in vitamin B12. I want you to think about the consequences of this. A newborn being nursed by mama who is a strict vegetarian is not getting the B12 that is necessary for DNA synthesis. We cannot give B12 directly to a baby, so moms who are vegetarians or vegans that are nursing their babies really need to get good B12 supplementation. In addition, some medications may interfere with B12 absorption and therefore lead to a deficiency of vitamin B12. Chloramphenicol is an antibiotic that is frequently associated with B12 deficiencies. Patients that have any of the prazole drugs prescribed for them, these are proton pump inhibitors, and include some over-the-counter drugs, as a matter of fact, such as omeprazole and esomeprazole, are going to have a deficiency in absorbing B12. Patients that have what's known as a H2 receptor antagonist to histamine, Tagamet, Pepcid, Zantac, can also have deficiencies absorbing vitamin B12. And finally, patients who have diabetes type 2 may be given metformin to improve their diabetes. About 30% of those patients will have a vitamin B12 deficiency, so all of these patients should be monitored for B12 deficiencies on a regular basis. We know that several risk factors for cardiovascular disease have been identified and are very well established. These include hypertension, obesity, diabetes, and lipid disorders. However, we also know that elevated homocysteine levels is an identified risk factor for cardiovascular disease. As we said earlier, homocysteine is broken down by vitamin B12. So higher levels of B12 help reduce homocysteine. It can be enhanced a little bit by folic acid, but If someone is B12 deficient, they may have an increased risk of cardiovascular disease because of the high levels of homocysteine in their system. We also know that the high levels of homocysteine can inhibit production of the neurotransmitters in the brain used in memory and cognition. Low B12 levels have been correlated with a decrease in cognition. B12 is frequently promoted for improved energy. This is based largely on the role of B12 in RBC production, which in turn contributes to oxygen delivery. We know, for example, that high-performance athletes may choose to train at a high elevation training center because that's going to force their body to produce more red cells for oxygenation. Then when they go to a lower elevation to compete, they have all that extra red cell, all that extra oxygen in their system. So B12 is like training at a high elevation center. All right, maybe not, but close enough. Supplementation by mouth with B12 is very common. In fact, it's going to be found in most multiple vitamins. But to reiterate, the ability to absorb B12 when taken by mouth is dependent on the level of intrinsic factor produced in the stomach. Studies have shown that about 1/2 of a microgram dose, that's 1/1000th of a milligram, is going to be absorbed, and the rest of it's going to pass out in the feces. And at higher doses of B12, much, much less is absorbed. So, if a healthy person takes an oral supplement that has 500 micrograms of vitamin B12, that's pretty little. Only about 10 micrograms will be absorbed. That works out to about 2%. The better way to supplement with vitamin B12 is through an intramuscular injection. Once we decide to do B12 supplementation, consider that there are 3 forms that are most commonly used. Cobalamin is the inexpensive and therefore most common form of B12 used. The cobalamin has to be released from the cyanide base prior to being absorbed into the body. Another form is hydroxycobalamin, which is highly effective. It actually stays in the body for a little bit longer than the cyanocobalamin. The third form is the one that we prefer because it is the type that the body doesn't have to change. It's the methylcobalamin. And when given by injection, the body readily absorbs it. So how much B12 is too much? And the answer is there is no known level that's too much. It's not toxic, and there is no established or recognized upper level. Remember, it is a water-soluble vitamin, so it's going to pass out of your urine fairly quickly. So you cannot have too much B12 in your system. Thank you.